Students in Oregon will be allowed to take mental health days off from school just as they would sick days under a new bill signed by the governor.
Joining us on the KOGO News Live Line, licensed professional counselor Lee Richardson. And Lee, taking a look, couldn't you just call in sick like normal people do whenever they're taking a mental health day?
Well, I think some kids do. They have their mom say that they can ask to do that. But not all families are structured that way. And I think, if you understand why the bill was passed, this was a state that was second highest for a suicide rate. In suicide for the ages 10 to 34, it's the second leading cause of death in the United States. So there was a little bit of motivation that prompted Oregon to take action.
So in your opinion, this is a good idea?
I think it's a great idea. I think, we've always been so focused on our physical health. If you've got the flu or a sore throat, you don't need to go to school, but we don't think about our mental health. And if you're feeling so anxious that you really can't focus, or you're so depressed that you can't get out of bed and you're just going to go to school and be angry, are either of those situations productive for the student or for other students? No. I think it's a great idea. I think that we have to recognize mental health, and we have to recognize it on the community level.
Are we coming to a point where we're starting to take this really seriously? I work with the American Foundation for Suicide Prevention, and getting it through people's skulls that suicide is one of the leading causes of death in the United States, especially among children, is incredibly difficult. It's like people don't want to believe it.
Well, I think they don't want to believe it, and they don't understand it. We need to educate people. That is the only way that we're going to get prevention, is educate. Did you know that suicide is a 10-minute decision made in the brain? So if in that 10 minutes, when you are so low, you know that you can reach out to somebody, there's 50-50, yes or no. You might do it. But if you're so low and you don't know what your options are, then you're not going to have that 50-50.
Now, here's the problem. What if a parent says, well, no, you're not staying home for a mental health day. You're not sick.
Well, and that is a problem, and I think that goes back to what I said, education. Parents, and sometimes it's not that they don't want the child to stay home. They both work. They don't have paid time off. It's more complicated than that. They absolutely can't have that child miss a day. So we've got to educate.